Thank you very much for this opportunity to be able to share with you some thoughts about sexual and reproductive health rights. I'm Renzo Ginto, I'm from the Philippines, but I'm not going to talk solely about SRHR. Rather, I'll be talking about how SRHR is kind of positioned in the larger context of what's happening in the world. And that's why the title of my presentation is about what are these global transitions that could actually serve as new threats to the achievement of SRHR. For the past couple of hours, we've been talking about investing in SRHR. But what I also want to introduce is that there are global forces, there are things that are happening outside of the realm of SRHR that could actually threaten or even delay or impede our achievement of these important and fundamental human rights. So, and I would like to thank Dr. Osweg for giving some introduction about the Philippine story that makes my presentation much easier. But the Philippines, as already mentioned, is a big country, 100 million at the moment. It's an archipelagic nation in Asia, and it's a predominantly Catholic country. So that is kind of the backdrop of SRHR dynamics in the Philippines. And I would like to show to you the situation in terms of health, and I would like you to focus on maternal mortality, which I believe is the most important indicator of the health of a health system, because pregnancy is not supposed to be a mournful or a tragedy for a family. Maternal mortality, for example, in the biggest cities in the Philippines, like Manila, is already like 15 or even less. However, in the outskirts, in the provinces, it could even reach up to 150. In fact, from 2008, with an MMR of 160, in 2012, when they did another review of the statistics, it became 212. So it even increased in a sea of global decline for maternal mortality. And yes, our government had lots of excuses. They used new formula to calculate maternal mortality. But whether it's 168 or 212 mothers dying, that is unacceptable in the 21st century. And so our mothers, the women of the Philippines, as well as the men, and basically the entire society, have been for the past 16 to 20 years fighting for reproductive and sexual rights. And as I've said, it's a long struggle because of the predominantly Catholic background of the country, very conservative government that is beholden to the Catholic Church. But what happened in 2012 is that we were able to see the light of day. The reproductive health law was passed, as Dr. Osweg has mentioned. This has been challenged in the court. And so just recently, the Supreme Court declared it as constitutional with some amendments. And the battle at the moment is really implementation. So yes, we might have the policy framework, the policy instruments for sexual and reproductive health rights, but if governments are not able to implement them well, if they are not able to provide the necessary services and information and reproductive health materials that people need, then it's just futile. It's just not being helpful to people. And yes, we're still a conservative country. We are still a Catholic country. Pope Francis just came to the Philippines last January, reminding the country to not give way to the new forms of ideological colonization of the family. And of course, he kind of implied on family planning and reproductive and sexual health rights when he mentioned or referred to some of the previous popes that actually said that contraception is evil. And so the president of the country, who is also very Catholic, has made a strong stance. For example, I am against abortion. So the barriers are still there in the country despite the presence of a law. And There are only 9 countries in the world with rising HIV incidence in a sea of global decline, and one of them is the Philippines. And also, the Philippines has an increasing incidence of teenage pregnancy. So around 1 out of 10 adolescents are actually teenage mothers. And recently, there were efforts to actually educate the young people about teenage pregnancy. However, this particular video that the Department of Health itself has produced kind of backfired because of the framing of teenage pregnancy. The video was saying that if you are a teenage mother, then you're stupid. And that is totally disregarding the social roots of teenage pregnancy and sexual and reproductive health issues. And I saw this in one of the online newspapers in the Philippines, that the issue of sexual and reproductive health rights is not just an issue for the developing world. This is from Norway. There's a 12-year-old Norwegian girl who was set to marry a man thrice her age last 2014. I'm sure you're very much aware. So it's really a global issue. And whether it's Norway or the Philippines, it's a common responsibility to address this issue. So the Philippines remains to be a poor country affected by so many adversities in life. And sexual and reproductive health rights are still elusive despite the presence of these policy frameworks. But I also want to caution my country in particular that there are other threats to the achievement of sexual and reproductive health rights. And these are the global transitions that I was referring to. I think that the sexual and reproductive health rights issue is just a byproduct of what's happening in the entire fabric of society, locally and globally. And I want to invoke the principle or the approach of social determinants of health. We need to make sure that the conditions in the social, physical, and economic environment are conducive to the achievement of sexual and reproductive health rights and to the achievement of health for all at large. So Dr. Virchow, who is the father of social medicine, I'm sure his name rings a bell, Virchow's triad, all those biomedical terms. He also asked, do we not always find the diseases of the populace traceable to defects in society? And also, just recently, the Commission on Social Determinants of Health reminded us that the unequal distribution of health and health-damaging experiences is a product of a toxic combination of poor social policies and programs, unfair economic arrangements, and bad politics. And this approach, this framework, also applies very much in the issue of sexual and reproductive health rights. So I think one of the messages that I'm trying to get across to you is that we cannot isolate sexual and reproductive health rights with a broader political economy of health. Because at the end of the day, all these forces are going to make or break the achievement of these rights, amongst other rights. So I just want to mention some of the global transitions that we are seeing now in the 21st century that could affect, or that are already affecting, sexual and reproductive health rights and their achievement. First is global migration. So this is an illustration showing to you the framework, the cycle of migration from the country of origin to the destination and back to his or her home country. And the Philippines is a country of migrants. 10% out of our 100 million population actually reside overseas. And I'm sure you've seen many of them wherever in the world. And one of the main issues now in terms of international migration is the feminization of migration. For example, in the Philippines and in Southeast Asia, around 60 to 80% of migrants who work overseas are actually women. They are your nannies and caregivers and nurses in your health systems and health services. They are your teachers. They are your instructors. They are your performers in theater, and so on and so forth. And in a recent investigation that we did in the Philippines on the health dimensions of international migration, so this is the country, and this is how the population is spread out across the world. And one of the major issues that was raised is the issue of maternal, sexual, and reproductive health among migrants, particularly women migrants. For example, pregnancy is sometimes, or if not oftentimes, not desired by employers overseas, and that makes women hide their pregnancy, which will eventually be later learned by the employer, and that will lead to deportation back to their home country. Unfortunately, some of them even terminate the pregnancy just because they are not accepted in the societies of the societies of their countries of destination. And also limited access to reproductive health services in destination countries because of the barriers for migrants or because of their migrant status. So as you can see, migration and the issue of sexual and reproductive health rights are deeply intertwined, especially in many contexts. That's why in the Philippines, we have created this network to really address the issue of health among migrants, particularly outbound Filipino migrants. And one of the things or the issues that we're really looking at is the achievement of sexual and reproductive health rights among these Filipino migrants. Another global transition that I want to bring to attention is climate change. And we might be wondering what's the connection between climate change and disasters and sexual and reproductive health rights. Yes, it's the biggest global health threat of the 21st century. And it's already a threat that is seen now in many countries, for example, in the Pacific, just like the Philippines. I will not go into detail in this framework, but it just shows to you that health is deeply affected by climate change. The Philippines is number 3 in the World Risk Index and number 6 in the Climate Change Risk Index. So that just shows how vulnerable the country is to disasters, extreme weather events due to climate change. And if we juxtapose or superimpose all the typhoons that have visited the Philippines, the country is virtually erased from the world map. And what's the connection? For example, in the recent typhoon that we had in 2013 in the Philippines, the strongest typhoon to ever hit land in world history, there were 200,000 babies that were born without a functional health system, without access to the essential health services that will be conducive for neonatal health. So that's an issue, and that's a sexual and reproductive health rights issue, especially in the context of disasters. Another issue is protecting women and girls in the aftermath of a disaster. So there are a lot of incidents of gender-based violence and also teenage pregnancy, unwanted pregnancies, because families are all compressed in very small evacuation centers. And of course, there's nothing to do in these evacuation centers. The system is still very patriarchal, and so women cannot really, decide whether they want to engage in sexual intercourse or not, especially in those kinds of conditions. So these are some of the realities that we face in terms of SRHR in post-disaster settings. Indeed, it's the worst disaster to hit PH, the Philippines, but also the people's health, and in particular, sexual and reproductive health. So, in conclusion, I hope when we look at sexual and reproductive health rights, we look at it from a much broader perspective, much bigger picture. We can invest a lot in sexual and reproductive health rights, but if the environment, our societies, the social fabric, if they're not conducive to the full achievement of sexual and reproductive health rights, we will remain to be coming up with reactive solutions rather than health promotive and disease preventive approaches. And yes, what good does it do to treat people's illnesses only to send them back to the conditions that made them sick? What good does it do to give them the condom or some reproductive health education, but we are still sending the mothers and the girls and the children back to the defective societies where they live? And finally, I just want to show this picture because it's not just investing in the health of women and girls, but also investing in their full participation in these global health efforts. I love this picture because I am surrounded by the women of the healthcare center in this community in the Philippines. It's really the women, the mothers, who are driving health systems. And I could proudly say that much of the things that I learned in life, I gained from the women in my life. My mother, my teachers, even the girls who gave me a headache or a heartbreak. But at the end of the day, we all are in this together. Women and men should be working towards a better world, a society that where we can enjoy all fundamental human rights, including sexual and reproductive health rights. So I hope we can reimagine the world, reimagine global health, one that can help us, achieve and get much closer to the health for all vision that we've been thinking about and dreaming about for many, many decades. Thank you very much.
Thank you so much. We're now opening up for comments. Yeah.
Thank you so much, Renzo. My name is Andrea Sones. I'm actually also a former IFMSA colleague for many years ago, actually. I'm a medical doctor and I do research on maternal health in Tanzania, where I live. I'm very happy to see that actually probably the IFMSA background has helped you to advocate so much for global health, and particularly for the Philippines. You already started with it at the final bit of your presentation, mentioning the women in your life and how they helped you and inspired you. And I actually wanted to ask you, with all the disasters and challenges that you presented to us of the Philippines, what does the Philippine woman or man, or what does the politics in the Philippines need in order to make changes, to make the environment more conducive, as you said?
That's great. Yeah, it's a big question. I can say that actually the Philippines, I am proud to say that the Philippines is one of the more gender equal nations in the world, especially among developing countries. I think it's in the top 10, It's the first among developing countries, and it's just after Norway, Sweden, the Scandinavian countries. So I might have given you a bleak picture of, in terms of women involvement. We already had 2 women presidents. Our Minister of Health at the moment is a woman. So it just shows how women are actually deeply engaged. And I think that's already an important ingredient in transforming society. Women involvement, gender empowerment. But yes, the issues still remain, and new threats are coming. As I've said, migration. The country is, the country's major export is really human resource. So it's in a way subjecting people to a lot of, health threats, both seen and unseen. I hope I'm answering your question, but so I think that's one ingredient that you might be looking for in terms of how we can transform Philippine society into a more equal and more prosperous and more healthy, a healthier society. And of course, there are so many other things that we can do.
Thank you, Renzo. Give Renzo a big hand, please.